Hi, I'm Kevin Krause, Director of Western Berks Physical Therapy, and our talk today is going to go over a few things about our clinic operations in the COVID-19 period and what we're doing as a clinic to mitigate steps in the spreading of the disease, and a little bit about how we got to where we are now with clinic operations with the disease going on. Back in the early days of the outbreak, Governor Wolf decided that we were an essential business and that we were going to stay open. This was followed up by a letter from Homeland Security that listed us as a vital and essential component to the infrastructure of the healthcare community, and also stating that we needed to be in place to help our patients. So the reason that we are open is that we need to be here for our patients. And this is for several reasons. First off, life continues to go on. In spite of the COVID outbreak, there are people that are getting injured, particularly at home now as they work on home improvement projects and so forth. Fractures continue to happen. We know that the elective surgeries and the elective procedures have stopped, but people continue to be in pain. We continue to get calls of people waking up with sciatica and the onset of sudden pain problems. The people with chronic pain continue to have their pain, and maybe they're unable to get to their physician for treatment or for an elective injection procedure that would normally quiet their pain. That's not happening. So in the sense of treating the patients, we need to be here and available so that those patients don't go to other treatment areas like the emergency room or the hospital, which are already getting burdened by these COVID patients coming in and unnecessarily putting themselves or their family at risk to go to those places for treatment. They need to come to a site like ours where we can treat them in a clean, sterile environment and without worry or concern about the disease. And they can get their therapy and get better and move on with their problem. So what I'd like to do is go over some of the steps that we're doing to mitigate the spread and transmission of the disease in the clinics. These are mechanical things we've put into place so that the patients and the staff are more safe during treatments. First off, we've done our best to screen what we would consider obvious symptoms in our patients. So if anybody who's got sniffles, a cough, a fever, we've asked them to reschedule, let that pass, and those patients that are coming into the clinic are healthy, they're feeling good, and they're not worried about anything that they're carrying. Secondly, we've modified the schedule so that we're treating one patient per hour. Each provider has only one patient per hour. This allows for a more structured approach to the schedule, more regulated, and we can keep an eye on the mechanics or the patient movements a lot better in the clinic. So there's not as many patients in the clinic at one time, and we can better orchestrate the movements and practice social distancing. We've asked that the drivers and the caregivers drop off their patients and then wait in the car, so they're not part of the waiting room situation. They're safe in their car. So social distancing starts right away as the patient arrives. There's no waiting in the waiting room. The patients are brought back immediately to the treatment area. That would be the gym or the private room situation. Other steps include the wearing of masks. We've asked patients and staff to wear masks during their interaction in the clinic. We've also asked patients to wash their hands as they come into the clinic and before they start their treatment, so that any germs are removed. And of course, the therapists in interacting with the patients are washing their hands before and after treatments. Also, points of contact that the patients have with equipment, frequently touched and used weights, exercise equipment, have been clean and sanitize immediately after their treatment. In addition to that, we've expanded our cleaning operations to do a deep cleaning outside of the clinic hours to disinfect and sanitize. So you can see for those patients coming into the clinic, we've done a pretty thoughtful approach to removing risk so that the patients can come in, get their therapy, feel comfortable, safe, and secure, that they're going to be safe from the spread and transmission of disease. For those patients who are high risk, or they're living with family members who are high risk, and they still feel that coming into the clinic is not an option, we do have telehealth options available through either video call or regular phone contact to allow those patients to keep moving forward, to prevent them from backsliding or losing progress in their therapy program. We want our patients coming into the office feeling safe, comfortable, and reassured that they'll be able to receive their therapy, have the successful outcome that they're looking for, and prevent the spread or transmission of COVID-19. Thank you for listening.